Today's episode of the Stallside Podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
It's 1:30 in the morning and you received a phone call from your farm manager. Your mare has to go to the hospital for dystocia. You get a second call saying she has to go to caesarian. On Stallside this week, I talked to Dr Brett Woodie, one of the surgeons at Rood and Riddle Equine Hospital, about what happens to your mare when she comes to the hospital for dystocia, and he walks us through caesarian, the value of this procedure, and how it's done. Dr. Woodie, welcome back to Stallside.
Thank you, sir.
Yep. So, Brett, quick tour of yourself.
Well, I've been here at Rood and Riddle about 20 years now, so been doing soft tissue surgery here for quite some time.
Yeah, that's quite an innings.
Yeah.
Yeah, most people would be on parole after that. Yeah. So today we want to talk about in-house dystocia. So just walk us through what happens. Client gets the call from the farm manager, hey, your mare's had to go to the hospital. We're having trouble foaling her on the farm. Everybody's best interest that she goes in. She hits the doors. What happens?
Okay. Well, fortunately, prior to her hitting the door, we've all been notified, and we've got a team of people, as you well know, as being part of that team, that's there to receive the mare. So we've got the surgery team, the medicine team, everybody's ready to roll. So as soon as the mare walks through the door, she's immediately sedated and started cleaning up our external reproductive tract, and then confirmed that in fact she is foaling before we move forward. Once all that's been confirmed, she's immediately walked into the induction stall. A intravenous catheter is placed, and she's induced under general anesthesia. All of that happens in a matter of minutes. It's very fast. And
yeah, it does happen very quickly, and I think that shocks people that come with the horse, just how quickly she gets to the doors, she gets attended to and put in the room, because that's time we can control. We can't control what's gone on before, and the clock has been ticking. So once she gets to that door, that's when we do have control how long things take. So once she's in that induction stall, what happens?
Well, once she's in the induction stall, she's under general anesthesia. They're on their side. They're then hoisted, and front and hind legs. We leave the hind legs on the hoist, and then we elevate the back half of the mare. That does a few things. One, it moves all of the reproductive tract and the GI tract forward, and gives us a little bit more room to work. Obviously, with the mare being under general anesthesia, she's not straining and pushing against us like she would be in a standing awake situation.
I think that's really frustrating for a lot of people. They think, I can get it. Right. But unless you've actually felt a mare contract against you, you don't really realize how powerful it is. And for the life of me, I can't really understand how any mare manages to get that foal out of such a small passageway. Yeah. The pressures are immense.
Definitely. Absolutely. It's amazing at the amount of force that the mare has to utilize in order to get that foal through the birth canal.
Yeah, and hoisting her and anesthetizing her, while it looks sort of pretty dramatic, that is actually really protecting the mare, because as you say, it makes it much easier to manipulate things.
Right.
So once she is actually hoisted, everything's given you some room to move. What's your approach? My approach,
first thing I'm going to do is take a feel and assess the position of that foal. What do I have? Do I have forelimbs, hind limbs? Is there a head there? Try to get an idea about the viability, which a lot of times can be really difficult to tell if that foal is alive or not, because the foal's anesthetized as well. And then once I've made an assessment of the position of that foal, now I view these, it's a puzzle. And I'm trying to get the puzzle pieces put together properly so that we can safely deliver that foal. So what do I need to do? Is there a leg flex? Do I need to bring that up? Is the head, do I have a head and neck that's flexed? Do we need to bring that up into proper position? And then once I've made that assessment, start working toward getting that foal in a proper position in order to be delivered.
You know, they got 4 legs, 2 front and 2 back. So what's your way of assessing whether you have a front or a back leg? Because that's really frustrating for people on the farm, and that's a decision they need to make quickly.
Yes.
Because you do not want to feel a back leg.
Yeah, or you don't want to feel more than two legs in there. So for me, the first thing I do is I'm going to go for the fetlock right up and make sure if I got a knee or a hock. And sometimes it can be confusing between a point of an elbow versus a hock. But I'll feel for the carpus and make sure that's what I have, and make sure if I've got two legs, are they both the same? Meaning, do I have two front legs? Do I have two hind legs, or do I have a front and a hind? What am I really dealing with?
Yeah, because we've all been in that position where the foal is presented and one front and one back has been pulled.
Yes.
Or only one front has been pulled.
Or we've had one where they've been pulled and no one realized there was a hind leg coming as well. And now when we reach in there, we've got four limbs and a hind foot all in the pelvic canal. So those are all very, very critical assessments we have to make very quickly, because as you said, we're on the clock, and because we need to get that foal out as quickly and as safely as possible. And if we're not able to do that in a controlled vaginal delivery, so in the induction recovery stall, then we're going to need to proceed to cesarean section.
Yeah, and I think people need to realize that the decision for a cesarean is actually made relatively quickly, but it's not made lightly. And there's various things that go into that, right? I mean, it is a surgery and it prolongs the period, but what are the advantages for going for that cesarean as opposed to vaginal delivery?
Well, I think a few things. Our ultimate goal is to get a live foal and a reproductively sound mare. So there are certain positions that foal could be in that may preclude us from getting a live foal out, or we may damage the mare severely in trying to do that. So, if we get the foal out, but yet the mare's cervix is damaged severely, that may preclude her from being a reproductively sound mare going forward. Or if we end up with a uterine tear, or there's any number of things like that could happen. It's just sort of the potential hazards of foaling. But if we can avoid those, then obviously that's going to be ideal for the mare long term.
I think that's a really important point to make to owners, is that the mare is much better off having a controlled incision in her uterus than an uncontrolled tear of the cervix, because the uterus heals up really well.
That's right.
The cervix, not so much.
Right. And we've all seen mares that develop cervical lacerations and defects through just natural normal foaling.
Yeah.
It happens. And yes, we can do surgery on those, but if we can avoid having to do that, then that's better for her long term, for sure.
So you've got this foal positioned well. You have two front legs, no back legs. The head is there. How do you go about getting that foal out successfully? So
what we're going to do, we're now going to place some nylon straps above the fetlock on the foal and around the pastern, and we're going to instill some lubricant to help lubricate things, because obviously the fetal fluids a lot of times have dried by that point. So now things, we don't have the lubrication. So we'll add that. And this mare, remember, is still hoisted. So now we're going to lower her down. And so now she's going to be flat on the floor, and we're going to apply traction to the foal in a very controlled manner. Obviously there's a certain level of strength that's required, but most of this, it's not all about the strength. It's about having that foal positioned properly and delivering that foal. Because I don't want to apply too much traction and potentially injure the foal or injure the mare.
And the direction of that traction is not really a case that you want to pull straight back.
Correct. Yeah, you want to try to follow more of a C shape, sort of a natural curve, because that's how the foals normally are born. So definitely that's a very important point that we're gonna utilize. And if we're not making progress, then we have to decide, okay, why is that? Why isn't that foal being delivered? Is it literally a mismatch in size, meaning the fetal size is too large for the vaginal or for the birth canal, or are we dealing with some other reason? Is this foal contracted somewhere? Do we have a hind foot that's coming? Why is this not progressing in an appropriate fashion? Yeah,
one of the mantras you hear is that the mare will never have a foal that's too big for her. I'd like those people to come and see us in the wee small hours of the morning in the spring, because they very successfully can have foals which are too big for them.
Absolutely.
Yeah. And so once that foal's been delivered, handed over to the medicine service, that's
right.
where I come in. But
Yeah.
what say that foal doesn't come out
Yeah.
in an expedient fashion, then we're going to go to caesarian.
That's correct.
Talk to me about the preparation of the mare for the
Okay.
caesarian and what the stages are.
Okay. Well, so all of this is a continuum, meaning as soon as that mare is dropped and started hoisted, there's a group of individuals that are clipping and starting to prep her abdomen. Just on the chance that we're not able to deliver this through a controlled vaginal delivery, now we're prepared to go right into C-section. In addition to that, we've got somebody keeping time. So somebody's calling out time. You've been working 5 minutes, 10 minutes, wherever we are, because we don't want to delay too long. So if I'm not, and sometimes that decision for C-section may be immediate. If I feel, if I've got both forelimbs and a hind leg coming or something of that nature, or this is a transverse presentation, there's certain conditions where you are going to go to C-section immediately. So that call's made and she's on the table. Other times we're going to attempt controlled vaginal delivery, and if things aren't going the way we would like, then again, time's a factor. So if I'm upwards of that 10 to 15 minute mark, and this foal's alive and we're not making appropriate progress, now we're going to get her on the surgery table. Well, we've already got her clipped and the surgical prep started. So she'll be transferred from that induction stall to the surgery table. Once that happens, we'll continue the prep. Somebody's going to be getting the surgery room opened, and we're scrubbing and getting ourselves ready for the procedure. And I should back up and say, all of our instrumentation, everything is set at all times. So we're not having to gather the gear. It's already ready to go. So, we've got to be prepared. You can't be too prepared for these. And I think that's really critical. And that's, I think one of the reasons we have been very, very successful is the process that we use. Everybody's well trained, and everything's ready to go at a moment's notice.
Yeah, there's a word you've used many times so far, and that's time. And that's the one thing we don't have. And like I alluded to, you can actually control what happens from the time the mare arrives at the hospital till you make a decision and go through the process, but you can't control what's gone on before. And there was a great study out of Colorado State University by Pat McHugh and Ryan Ferris, where they actually looked at this group of foaling mares, and after 40 minutes from the onset of stage 2, which was when the mare breaks her water, after that 40-minute period, the rate of illness for the foal and the rate of mortality to the foal really started to accelerate. So there's a lot of situations where we may be 10, 15, 20, 30 minutes behind by the time this mare gets here. So for anybody listening, and if you've ever seen us, that's why we actually move pretty quickly.
Yeah. Time is of the essence, and we are very fortunate in this area. Most of our mares are coming from close.
Oh, yeah.
And they're well attended. The farms know what to watch for. They know when they need to send them, so they don't delay. And I think that, it's obviously it's a team approach. Everybody's on the same team here, wanting the same, positive outcome. And that helps us as well, getting those mares in as quickly as possible to give us the best chance at a healthy, viable foal.
The mare's on the table. She's been draped. The prep had been finished. Everybody's standing around dressed, ready to go. You have the scalpel in your hand. What happens next? So we're going to make an incision along the midline. So we're going to start just in front of her udder and go toward her sternum, and so we'll make a long incision. Then we're going to once we're through the body wall, then we'll exteriorize the uterus, and typically we'll find the hind leg of the foal in the horn of one of the horns of the uterus. We'll bring that up and out of the incision. Then we'll make an incision through the uterine horn, and now we can retrieve the foal, and we're going to bring the foal through that incision. And once we've done that, we'll clamp the umbilical cord. We'll cut that, and then we'll transfer that foal to you guys on the medicine team for resuscitation. So you mentioned about finding the back leg and the horn. So you actually will always want to go into the horn that has that back leg, and you'll basically incise the uterus along that direction.
Correct.
Of that leg.
Yeah, we'll start toward from the tip of the horn back down toward the base of the horn. Now there are situations where the foal is no longer in the horn; it's in the body of the uterus. Those are quite a bit more difficult. You're not able to exteriorize those, so now we're going to have to open that uterus down in the abdominal cavity, So we're going to have contamination of uterine fluid. Whatever fluid is in the uterus is going to get into the abdominal cavity, which can certainly be problematic depending on the situation.
How difficult is it to exteriorize that horn for, say, the mare's been trying to foal for a while? Is this relatively easy when the mare's anesthetized, or is there tone in that uterus that makes it difficult?
No, there certainly is tone, and if you've got a big heavy foal, and depending on the positioning, sometimes it can be difficult to get the uterus and the horn rolled into position to exteriorize through the incision. But
okay, so the foal came out. You handed the foal off to somebody like me to worry about. You have this incision in this uterus.
Right.
How do we put it back together again?
So the next step, now we've got placenta that's attached to the lining of the uterus. So we're going to need to. A lot of times that will start to detach and strip away easily. If we can remove that entire placenta at the time of surgery, I like to get it out of there if at all possible. Sometimes that's not feasible. It's just too well adhered to remove at that time. But we definitely have to strip it back from the incision. This organ is extremely vascular, so there's very large vessels there. We've got a lot of hemorrhage, so we're going to need to control that. Or obviously the mare could have blood loss, severe blood loss, and a crisis in that from that. So we'll strip that placenta back from the cut edge of the uterus. Then we'll take suture, and we're essentially going to whip stitch that cut edge of the uterus in order to compress those blood vessels so that we can control and stop the uterine wall from bleeding.
Okay. And so once you've successfully gone around the edge and stopped that, how do you close the uterus? Yeah. Is it multiple layers? Is it one layer?
Yeah.
What do you do?
So what I do is a double layer closure. 2 inverting layers. So we'll place our first layer, and that starts the cut edge of the uterus to roll inward, and then we'll oversew that with a second layer. And once that fold is removed, this uterus automatically starts involuting. So it's going to get smaller and smaller and smaller. It's actually quite amazing. You go from a uterus that's going to hold a 140-pound foal down to pretty small in short order.
Yeah, that's actually quite impressive how distensible the uterus is. Yes. Like you palpate like a non-pregnant mare, you can get your hands around it, and then you put that foal in there, and then it just goes back to approximately a normal size so quickly. What about care of the rest of the mare's abdomen? You mentioned sometimes, depending where the foal's located, there may be a little bit of a spillage in fluids, which nobody can prevent.
Right.
So how do you actually manage that mare's peritoneal cavity to ensure that she has the best chance of no problems?
So once we've got the uterus closed and we're happy with how that looks, I'll go ahead and palpate and inspect the rest of the uterus, make sure we don't have any tears or any other any damage that we were not aware of. Once that is all checked out, A-OK, look for any hemorrhaging, broad ligament, that sort of thing. Well, we'll go ahead and replace the uterus in the back in the abdominal cavity. Then we'll do a full abdominal exploratory on this mare, and that does a few things. One, we confirm that we don't have any previous or prior existing problems associated with the GI tract. Could you have a mesenteric rent or a defect or an adhesion from something? We would want to know that. So we'll do a full abdominal exploratory, make sure the diaphragm's intact, no problems associated with the GI tract or anywhere in the peritoneal cavity. Once we've done that, then we'll use sterile fluids to lavage and suction to remove that fluid from the abdominal cavity. Once we've done that, we're satisfied everything's in good order, then we'll go ahead and close the body wall.
So timing, how long from the time you cut till the foal comes out, and how long from the time the foal comes out till you put that mare back together again?
Well, the from the time of cutting to getting the foal out is just a couple of minutes. It's very fast. The rest of it slows down quite a bit. So you're probably looking at all told about 2.5 hours of for the mare from start to finish. But the foal's out in just a couple of minutes.
Hey, I think people need to realize that too, is that again, you go in there, you get that foal, take all steps, take all care, but putting that mare back together again is a very meticulous, exacting, cannot be rushed process.
Yeah, exactly. And for me, I want to have that uterine horn, I want that lined up perfectly so that we get absolutely the best healing that's possible. And that all starts with how you make your incision, where you start, where you end it, and how you close it.
Yes, I've looked at you work a lot, and there's a lot of thought going into putting that mare back together again. So now you've closed your incision. She's off the table. She's wheeled to recovery. What happens then?
Yeah, well, at that point, she's going to be in recovery for a bit. These mares are pretty exhausted by that point. Once she's standing, we'll get her back, get her down to the stall, hopefully with a live foal down in ICU with you guys, and typically have them on antibiotics, anti-inflammatories, IV fluids. They're allowed to eat. Try to get them back normal as quickly as possible.
Yes, there's there's always two patients in the stall, right? You've got the mare getting over the surgery, and you've got the foal getting over whatever, and that foal needs to be fed. So a lot of effort is expended in making sure this mare's as healthy as possible. Right. And it always surprises me how when these mares wake up, some of them, they're already calling for the foal. Yeah. It's sort of like I had a sleep, and then all of a sudden they immediately know something's missing. Where is it?
How do they know?
Right. Yeah. So how many cesareans do you think you've done over the time you've been here?
Gosh. For me, I probably do anywhere from... Some of them are scheduled, meaning they're planned for various reasons. Most of those mares are ones that have had cervical injuries and had repair, and we don't want to run the risk of a future injury, so they get elective C-sections. Between elective and the non-elective C-sections, I probably do 10 to 12 a year, just me.
Yeah, so that's quite a number.
Yeah. So they add up.
Do you remember your first one?
I'd like to tell you I do, but I don't.
That's okay. But I mean, it's a fascinating procedure to watch. It's something that's it's sort of a privilege to be part of, but it's sort of a fascinating thing to watch as they actually just go through the motions. The mare arrives and the decisions are made, and then the foal comes out, and we all hope for the best for everybody.
Well, I think it's very impressive because it's very well orchestrated, and everybody knows what to do. And we've got everybody in place, and it flows so smooth. And it's very impressive to sort of from the outside looking in.
Yeah, and it's not just us either. It's sort of like the support staff we have.
Absolutely,
the technical support just makes us look good every time.
Right. No, it's everybody. It is a team approach. Everybody there has a job. Everybody knows what to do, and without them, it wouldn't go nearly as smoothly.
So an uncomplicated cesarean. Should the mare come in, have the foal delivered, goes to the ICU. If the foal is not an impediment to the mare's recovery, how long would she be staying in the hospital?
Oh, they're probably going to be with us 3 to 5 days, somewhere in that ballpark if everything goes smoothly.
And what about aftercare for that mare once she goes back to the farm?
Well, once she's at home, they're going to be on a period of some restricted activity until the body wall heals. Generally speaking, they're going to be on restricted activity for about 30 days, and then they can if the incision's healed appropriately and they're doing well, then they can get back into normal turnout by that point.
And of course, the question is, I have one foal and I want another one. When can I breed that mare back?
Yeah, well, a lot of that depends on how the mare's doing and how she's healing. We certainly know, looking at these mares retrospectively, that fertility in the year of the C-section is not as high as it will be in subsequent years. Can you get a mare and foal the same year as a C-section? Sure, you can do that. It's a bit of a challenge, though. It depends on the time of the breeding season in which the C-section occurs. If we're fortunate and she's been a very early mare, then there's a shot at getting her in foal the same year. Although the percentages certainly aren't in your favor.
A mare that's previously had a cesarean, what would you tell the owner as far as her ability to safely deliver a foal in the future, unassisted?
Yeah. I don't think, unless there was some physical reason, meaning the mare had a pelvic fracture and she's got some anomaly associated with that. I don't think it will be I don't think she's destined to have C-sections at every go.
Yeah, it sort of surprises me just how well they can heal up and then turn around and go through all of that pressure we talked about before and deliver that foal post-cesarean and not just automatically have to have one every year. Right.
And it's interesting, some of these mares that we've done elective C-sections on for many, many years, you can see the old incision right in the uterine horn, and most of those I go back through the old scar It's very, very amazing at how those heal, and the lack of any adhesion formation to those has always been very impressive to me.
Yeah, that's actually quite surprising because horses like to form adhesions.
Exactly.
And to be able to go into those mares repeatedly and not have that problem, I think says a lot about the care that's taken during the caesarean.
Right.
Well, any last words or advice for the owner of a mare who just got the phone call at 3 a.m. she's getting a caesarean?
Well, I pray for a good outcome, and that's obviously, if that's what needs to happen, then that's going to be the safest for her and the foal.
Yeah, I think that's sage advice. So on stall side this week, we've been talking to Dr. Brett Woodie. He's talked us through a caesarean in a mare that comes to the hospital for dystocia. See you next time.